to
change their kids to gay, to kill,
Oh,
to kill their old
that's a
people,
good one.
to somehow suck their intelligence out of them, like it's so many different reasons that you hear people come up with it, and also like in the U.S. to your question, in the U.S. like, one of the things is you have a system, and you have a Medicare system. You pay for insurance. You can go to the hospital anytime because you already have the system happening, working for you. But in the Gambia, when you go to the hospital, you don't have any system. You go there and you pay right there.
Oh, okay.
So you go to the hospital sometimes, you have to pay for the injection. You have to pay for even the drips. You have to even pay for the doctor to use the gloves they have. That's how that's how some hospitals look like. Some of our major hospitals don't even have gloves, and you find people like me and other people going out of the country to look for other hospitals that have so many stuff like gloves and things donate to a country like the Gambia. So, like for example, when it comes to malaria, we get it covered because Bill Gates gave it to us for free. He gave malaria tablets and mosquito nets for free. So that is why we are able to tackle those kind of illnesses.
From philanthropy.
Yeah.
Yeah, I got you.
How are, like, if you're gonna go to the hospital and see a doctor there, how are they trained or educated?
We have a nursing school, a medical school.
A
It's
medical
very competitive to get in there.
Uh-huh,
Yeah, the top students always get in there.
uh-huh.
But then this is something I see. So we have a lot of private hospitals. And all these private hospitals, they're owned by individuals who works in the public hospital. Now you go to a public hospital, there's no medicine, there's nothing for you. But when you go to the private hospital, everything is there. But now you have to pay thousands of dollars in order to get access to all of those things.
Yeah.
Sometimes you go to the hospital, you have nothing. This hospital people, they have pharmacies in the neighborhood, and they'll tell you, they won't tell this is my pharmacy, they will just direct you to their own pharmacist and say, go and buy these and things. So now you go to the hospital, you're paying bills to be in the hospital, but then you're also going out to pay more bills to buy medicine and everything that you need. So some people see that they can spend less money by going to herbalists than going to a hospital. So I'd rather go to a traditional doctor and give them $10 than go to a hospital and pay $1,000. Those are some of the notions that people have.
So you said those who go to the public hospitals are the ones who have private?
95% of people
So-
who work in the public hospital, the doctors already have their private hospital or private clinics and private pharmacies.
So are they using the resources from the public hospitals to
The
start?
notion is they are using the resources from the public hospital to start their own.
Public, oh my, that's dirty politics.
Yeah. Like for example, there was an incident in my country where this company, they're from India, they sent a syrup in the Gambia, cough syrup, and it kills hundreds of kids.
Oh, really?
Because the cough syrup was not good. And instead of, up till date, Gambians are protesting for justice for those kids.
Yeah.
Up till date, it's been over 4 years. And we cannot still have explanation how those syrups made it to the healthcare system, that they were able to distribute this, and then kids were dying because of those.
They were contaminated.
Yeah. So that is why I have this dream that I want to get my degree, and one day I want to start my own hospital in my country where I can make Medicare accessible to the people, to the young ones, to the poor, and also use my voice to educate people to take care of their health. Because I feel like early intervention in every aspect is very important, and that is lacking in the Gambia. Because here you can see early intervention everywhere, even on social media. People talk about, oh, do this, go to the hospital. That is not happening in many countries in Africa. Yeah, you know.
I would like, if to open the floor, if those of you online have questions you'd like to ask. There's some chats, okay. I went to Tanzania last summer. And if a patient was coming in for surgery, they had a list of supplies that they had to bring with them. Is that the same where you're from?
The same, like, the needle that you use to give injection to people, they'll ask the patient to get it.
What?
They'll ask you to
Wow.
get it, they're like, we don't have needles, we don't have, that doctor is telling you, I don't have a glove to wear for you, so I cannot treat you.
Wow.
Those are some of the problems.
Hard to wrap your brain around that. We really have so much in this country. We sometimes,
You don't even
we
know how much you,
we sometimes take for granted.
you
how
don't
much we
even know
have.
how much you have.
Yeah.
I've seen time and time again, people have to go and buy a glove for a doctor to wear in order for them to treat them.
Wow.
There's another question.
I have a friend who worked with the pipeline in Africa, and I wondered if you were aware of this project and if it involved the nurses at all.
What does the pipeline, what do they do?
I guess, I think, Loretta, are you referring to the fact that were nurses involved in that they had all these workers? Like
Yeah,
we,
they,
go ahead.
our own K&A member, Tracy Littlehill, worked with some people in Africa, and it had to do with the pipeline. And I just wondered if you were aware of that project. I'm not sure what all they did or anything, but she was like, she really worked a lot with a group of people from there. So I just wondered if you were aware of that, or any of the, she's a nurse, so I just thought maybe other nurses, you might be aware that they were involved in that. It was a big passion of hers.
Loretta, you mean, to understand, do you mean oil, a pipeline for oil?
Water?
No, I think it really had to do with water and like healthcare for patients and for people that lived in Africa. So I can find out more details from her, but I didn't know that much about it, but I just know she was very involved in it.
Oh, what country?
Africa.
That's amazing.
In Africa, it was in
Whole
Africa.
continent.
I know, that's what she said.
Yeah, you need to explain to us what you
I'll
said.
give her a text and see if she has any more information.
Oh, that would be good.
Yeah,
Yeah.
I'll do.
West and where you're.
So Africa is like very big, it's a whole continent, and I am from the west part of the continent, and my country is the smallest in the west part of the continent. So yeah, so my country is in the west part of Africa, is in West Africa, and the smallest in West Africa, and it's called the Gambia. It's very, very tiny in the map. It looks like a snake, but it's surrounded by Senegal, which is commonly known by so many people around the world.
Mhm.
So it's surrounded by Senegal 3 times, and then the fourth part is the Atlantic Ocean. So, but then you have other part of Africa, like South Africa is a country, and South Africa as a side in Africa that is in the south of Africa. So when people talk about South Africa, they always think of South Africa as a country. There's a
Uh-huh.
country called South Africa. And then we have East Africa, that they mostly they have English as an official language, but they have a second official language called Swahili. And yeah, so the East Africa have Tanzania and the Kenyans and Uganda and all of those things. So, and then you have Central Africa, and then you have North Africa. So it's really, really big.
So where is Gambia in relation to, say, Ghana or Nigeria?
Ghana and Nigeria are in the same side of Africa
Yeah,
with us. We are all in West Africa.
Yeah, I knew they were all west, but I
Yeah.
wondered if Can they you were close put that together.
Yeah, we are close together.
Okay.
We have the same people moving from when we have Ghanaians in the Gambia, Nigerians in the Gambia, and likewise Gambians over there. Because we are called the ECOWAS state. So West African states are called the ECOWAS state. And we have an understanding where you can go to each other's country without a visa. You just have to go there and you can go and stay there.
Here's the map. And you see the Gambia? Right over there
Yeah.
in West Africa. but it's shaped like this, as she said, it's like a snake. And this border is the Atlantic Ocean, right? And then so where in there did you live? Are you from?
On the map,
Mm-hmm.
go so lemon.
There is no line here, but like you can just identify as per town.
Is it in Brikama? Did you see Brikama? Good, that's why I actually grew up right
Right
there
in
in
here.
that town, so yeah, that's where I'm from.
That's the capital city of Uganda.
Oh, okay. Are you in your same town, right?
No, I'm
No.
from Serakunda.
Oh, okay. Okay, thank
Well, the
you.
Gambia is very small, almost everybody know everybody. Like if you don't know someone, you know someone who knows that person, so people are all interconnected and related.
Okay, so back to some questions here. Is there any kind of oversight for the healthcare industry in your part of the country? Like here we have CMS that oversees healthcare quality. And there's a lot of regulations and rules that our hospitals, doctors, nurses have to follow. Is it the same there?
Yeah, we have the Ministry of Health
Oh, okay.
that is in charge of the healthcare system. And then we have public health officers that work under the Ministry of Health. They make so like even the food we eat are safe. They go around and see that, and then they go to the hospital and make sure that it's hygiene enough for people to live there. But also, like, I don't know, this is everywhere in the world. Politics is actually affecting so many countries. And the Ministry of Health, instead of being an independent entity, is under the government. And with that being said, they're so corrupt, they don't care about the masses, they only care about how much money they can get and all of that. And they don't invest in a healthcare system. We have seen that for now 10 years. There's no investment in the healthcare system. Individual citizens are the ones going out trying to make a difference, but not the Ministry of Health. So,
Now, do the nurses and doctors have to have licenses in Gambia?
no, you don't. So doctors, when they go through, if they go through the School of Medicine in the Gambia, they just have to pass the exam, and that's it. They graduate, they got good grade, they can get a job. But that's one of the reasons why I didn't do nursing in the Gambia. There's so many other nursing schools that are not actually recommended. Like, so everybody can just start a nursing school as long as they get the money. So you have all these people going to nursing schools and they all work in the hospital, they cannot even write their own name. So that is crazy. So you find them like always, those are the ones that they give them to sell tickets or dress wounds and stuff like that. But yeah, we have that system there. And some of them just graduate and say, oh, I have a nursing degree, but they will never become a nurse and all of that. So that is why I do not pursue my nursing degree in the Gambia.
Do you plan to go back?
I plan to go.
All right.
Can you hear me?
Yes.
Oh, okay. Thank you so much. So there's a lot of people living well and living long in Africa. So a lot of things there work really, really well. What would you say in the health system from your area works really, really well and you would want to share with us and our healthcare system?
I think when it comes to the world, I've seen like other part of the world, they have like high rate of infant mortality. And in the Gambia, we don't have that. And for example, like kids are very taken care of. And like, because I watch other countries and I see how polio affect other part of the world. But even though Gambia have so many traditions and all of that, they may object to a lot of traditions, a lot of modern medicine. When it comes to polio, we do every year, we go around and vaccine all the kids in the neighborhoods. It is something that Gambians actually appreciate and they openly accept that. And that has helped with having kids that grow up without defects. Because you need to give polio to kids when they're 5 and below, so that they grow up with no physical defects and all of that.
Mhm.
So that is one part of the Gambian healthcare system that has actually made progress and is still something to be proud of.
Mhm.
When you go to the street of the Gambia, you will hardly see somebody with any defect. Like even things like autism, Gambians don't know it. You may find 1 out of every 1,000 have autism. So they don't even understand what that is. They cannot still, like, right now there are groups that are coming out to educate people about autism, but people are like, what is that? Like, people don't even know what it is. So yeah, we have good system when it comes to polio. And yeah, we have some health centers. Like, for example, we have new health clinics that are in the Gambia that provide healthcare for people. We have dentists that provide free dental care for people. They will go online and say, come to my pharmacy today, come to my clinic today. We're giving you free dental care. So we have good part. So it's just like in every country we have good and bad. Like, for example, when I talk about like the US and the Gambia. So in Gambia, I told you like how families will take care of their sick loved ones. They will be the ones responsible for that person. They will make sure that you get the healthcare. If I got sick in the Gambia, I don't have to worry about going to the hospital. My family will try to take me to the hospital. They will show up and bring food for me. They will stay over at night to see that I have somebody here to help me. And like I said, in the US, that may look like overcrowding. Can you imagine if I go to hospital here and 5 or 6 people just came to see me all at once, and they're all sitting, the hospital like, nope, yeah, I'll go out. This is not a place to be, like, and all of that. So we have all of those good things. That's why I said, like, not like all these systems, the Gambia and the US, we all have that. None of the systems are without a challenge. We all have our challenges.
Thank you.
Thank you.
Thank you so much.
Is health insurance available?
No.
No. You had alluded to that earlier when
Yeah.
you have to bring your own supplies. That was
Yes, you have to
pretty
bring your
funny.
own money. So it's more like cash. Like when you go to the
Pay
hospital,
for
you have, yeah, you
Pay
gotta
for service.
yeah,
Pay
you need to have
upfront.
your money ready. But some public hospitals are also free. Like you just have to buy a ticket, and if medicines are there, you get it for free. Like, for example, the community, he's from Sarakunda. They have a hospital called Carnifing Hospital. It's one of the biggest in that region. So when you go there, you just buy a ticket. So if your illness have anything that they have, you get to get it for free.
Okay.
Yeah, because I remember when I had an accident, they gave me a free X-ray. I didn't have to pay for anything.
Oh,
Yeah.
okay. Beverly said they had issues with staff stealing supplies brought in and using on other people or selling them and then refusing to do the person's surgery.
He's
Wow.
following up with the things he said about the other thing in Tanzania.
Yes, that's the same. Yes.
Yeah. And just, I know when it comes to other part of even West Africa, the Gambia is, even though we are small, but our healthcare is way better than other countries, because there are other places also in Africa that you have to take you, like when certain surgeries, you just have to save people out of your country for that. And in the Gambia, yeah, thank God we have doctors that can do most of all the surgeries that people need in that country.
So as bad as it sounds, it's not as bad as it gets.
Yeah.
Is that what
It's
you're
not
saying?
as bad as it gets. So that
As
is why I just
okay.
want to go back and advocate for my people.
Oh, absolutely.
Yeah.
Yeah. So Loretta, I guess, heard back from her friend, and the pipeline was water, agriculture, toilets, building community bridges. So it was a pipeline of service or a pipeline of care, I guess, is what the reference there was.
And it's in Ghana and Togo.
Uh-huh.
Mm-hmm. And that was the name of the that was the name of the project, Building Community Bridges, that she was involved with.
Oh, I got you. Okay. All right.
And who was doing it?
A friend of her. Oh, who was the actual?
Yeah.
Do you know that, Loretta? Now you'll have to text her.
Well, what was the question?
The question was, do you know who sponsored the project or who?
No, I can find out from her. She was very involved with it, and it was kind of like I said, a passion of hers. And it was a needed project too. So she used it like she was on the ethics committee for KNA. It's Dr. Tracy Littlehale. And so
Oh.
she was, yeah, so she was very involved in this project. And she was sorry that she didn't see the free CE from you all today because she's very involved in that kind of stuff. So I'll send her another text and
Well,
ask
there's
her.
another opportunity to have somebody come and speak, because that would be interesting.
Yes,
Um,
and she actually did a presentation for I think KNA. I think she actually did a presentation. So
Okay, wonderful. Well, thank you, Loretta.
you're welcome.
I just wanna, I saw Beverly saying thank you for the thing. I just wanna comment on, she was saying some, even though we have our things, sometimes our systems are even better than the US. And which can be true, Beverly, because like, for example, ever since I came to the US, I am scared of getting sick because I don't have health insurance. So I have this joke with my host family. I keep telling them, I said, I am not allowed to get sick in this country.
Not allowed.
Yes, because so whenever like I always tell myself I'm not allowed to get sick in this country because I don't have health insurance. So that is something for me that scares me. And I've seen as an international student at KSU, I have seen international students struggling to get some of their medicines that they are on, and they cannot
Oh,
because
that they
don't
take
have,
it home routinely and
yeah.
then they come here and they can't get.
they cannot get it because they cannot have, because the money too is expensive.
Oh, yeah.
And so it's very difficult. I've seen them come to the office, and this is gonna be my third semester in this country, and I'm still trying to get a good health care for the international community.
Wow.
And you can understand how many people are thinking like me. I can never get sick because if I get sick, I will not go to the hospital. That's one of my fear since I've
I
been
can,
here.
I can appreciate that. I could see why you would
And
feel
in the
that
Gambia,
way.
I would never have things like that. Yeah.
For your routine healthcare maintenance, I could see that. Now, the plus side is that a hospital will never turn you away if you're sick, right? But it's not able to get care to make sure you stay out of the hospital. That's the issue. So Beverly also went on to say that the food and lifestyle felt much healthier in Tanzania. And she can't wait to go back. People are so much friendlier and happier and less prejudice.
I was telling her that when we were coming, I said, I miss the food in my country because we cook fresh food. Every day we go to the market, get fresh vegetables and cook fresh food. And I just want to, I mean, y'all will be lucky. I'll show you my picture. When I came here, yesterday was my 1 year in this country, and I was a skinny girl. I got here and I gained so much weight. I am not comfortable in my body right now. I always complain about how I'm looking and how I'm not happy. My family called me, they're like, why are you fat? What happened to you? Like, they ask me every day, and I tell them I'm eating junk food in America. So the food in Africa is way good. The first thing I complain about here is the carrot. I tested it is different, and I was like, what is this? So like Africa have good food, and like I tell my new students when they come to school, one of the things you're gonna miss and that's gonna depress you is how friendly and how open everybody is in Africa. In my country, you don't even have to know people. You can say hi to them. You come to my country, you're stranded, people will give you their home, they will give you their bed and sleep on the floor for you because you needed it. They will share their last breath with you. In my country, we don't have homeless people. And I cannot get over that. Every time I'm in traffic, I see homeless people here. I'm like, okay, now let's talk about this. Don't they have a family? Like, don't they have father, mother, sister? If you don't have a home, can't you just go stay with your sister? Because that's how we
That's
do
how,
in
that's how
Africa.
you do.
That's how we do it. Like, if I don't have a home, he has a home. I'll stay with him until I get my home. I don't have to be in the street. We don't even have to know each other to help each other.
Mhm.
That's it. And my country is known as the smiling coast of Africa. That's because everyone in my country is always smiling to you. They're always welcoming to you. So yeah.
But
very
that kind of
excited.
speaks to the question that Monica, I believe, posed is, they have such longevity, so there's something right. So what you just described, their sense of community,
Mhm.
their sense of belonging, the nutritional state, you know, the fresh fruits and vegetables, the lack of preservatives, and that might be one of the reasons why you don't have so much autism in your country.
Yeah.
Just saying.
Yeah, people are really healthy in the
Yeah.
Gambia, and I didn't know that until I got here. I took it for granted, and my first semester here, I was getting fat and at the same time getting depressed because I miss actually telling people how are you. So our culture also is influenced by Islam, and then we greet in Islamic way, which is peace be upon you. So whenever people see each other, they're like Salaam alaikum. Whether you're Christian or Muslim, we all say Salaam alaikum, which is peace be upon you. And I'm so used to that. And I come to this country, I'll meet people and I'll say hi to them, and they'll look at me like, why are you saying hi to me? Like, but I'm used to saying, hi, how are you? Hi, how are you? Like, we don't need to know each other to say, how are you to each other. And here you don't get that, and it depresses. I got so depressed, and yeah, I miss my country.
You miss
I
home.
cannot wait to go back.
Yeah, I can sense that.
Yeah.
Yeah, absolutely. And Melissa goes on to say the friendliness could promote health. Isolation and loneliness is a profound public health problem. It's absolutely true. And then you've got folks all jazzed up about the food. Says said I love the food in Africa. And here's Beverly. I want to go there now too. So you've got them all excited.
Yeah.
The sponsor was BCB, a nonprofit organization.
Look it up.
Yeah, I was gonna say, we still don't know. No. Text her again. No.
That's a nonprofit organization in the Gambia called Staffis International. Y'all can look it up. It's a nonprofit organization that promotes girls' education. Every year they pay for 100 girls to go to school. And they have collaboration with other nonprofit organizations out of the Gambia, and they help people to get clean water for them and all of that. Well, one of the things they do is make sure that they help girls stay in school and go to school until they finish school. So
That's wonderful.
right now, I know since I left, I've seen them expand to trade. So whereas others who cannot go to schools, who doesn't want to go to regular school, can go and learn trade. So that's one of the things you can look up. It's called Staffis International. They're available on Facebook and all of that. And they're very good. So I like to give them as a reference because I actually went through their program as a young
Oh, you
girl.
did?
Yes, and they have shaped my way of thinking and how I can be of service to my community.
So along with that line of conversation, how did you get here? Did you get here on a scholarship? Did you apply for, tell us about that journey.
So I finished my first bachelor's in 2019. I finished high school in 2016, and I went to Gambia College School of Education,
Mhm.
and then I got my degree in English and Social Studies. And in 2019, I started teaching. But when I wanted to come to the US to study, I need to come up with my funds. Like for example, at KSU, all the schools I got 3 admissions, by the way. I got school in Owensboro, and I got school in Pennsylvania, and I got KSU. But all of them have certain amount of money that I cannot even dream of. KSU is the cheapest, and KSU want me to show that I have $2 million in my country. That is when they can actually even give me a paper to say, okay, you are accepted.
A visa.
Yeah, no.
No.
An I-20 is a paper that you have to go and apply your visa.
Oh, I see. Okay.
For them to give me an I-20, I have to do it. And from 2019, I've been trying to get to KSU because I couldn't have that amount of money. I could not come. And one of the things I do was I was teaching, I was doing small business, I make food and sell it. I was hosting events for people. I was organizing events for people. I tried my best to at least come up with something to pay my school fees. And by last year, 2024, I was able to come with, I just got only half of my school fees. And I was able to try again, but at this time I had to have somebody to say, to use someone
sponsor.
else's bank statement and say, this is my bank, this person is gonna help me if I get stuck. And then I came here. That was how I got my visa, and they were like, okay, since this person is gonna help you, we're gonna give you. And then I came, but that party is not helping me. So I was able to pay my first semester, and my last semester that I just finished, I was doing some work study at school. I work as at the International Students Office. I make videos to help other international students on how to transition. And I also work as a student leader between the international students and the student community at KSU, and between the teachers and all of that. So I'm working through paying my school fees. I've not finished paying my last semester yet. The next semester is coming, but inshallah, like we said in the Gambia, inshallah mean the will of God, by the grace of God, things will be better, and hopefully I'll get my degree. But just like I am, that's how much so many international students in my school goes through. We don't have scholarship when we come to the US. We have to provide money for us. And then we pay 1 year of our schools, and then we cannot go ahead with our education because we cannot even walk out of school. That we can only work a certain hours, that's 20 hours maximum on campus, and that is it. And every scholarship opportunity that comes into our school, you have to be a citizen to have it. So now we are not qualified for any scholarship.
Oh, yeah.
So that's the challenges that we are facing, that's the challenge I'm facing, and that's the challenge. Thousands, I mean, right now I have like, last semester I have 130 international students, and this semester I'm expecting another 70 more.
I'm not suggesting you change schools, but you might check into Berea College. They are really open to international students and no one pays tuition there. It's about an hour from here where we are now. But it may be a little bit more, but if you could.
My cousin goes to Berea.
Yeah, but no one pays tuition. Everybody works, all the students work.
Oh,
Yeah, they have a strong Monica, that's very active in, K and A. So you might contact them, and they have a certain percentage of international students that they take every
Yes.
semester. And so it might be specifically with you being interested in nursing, it might be, I mean, I'm not wanting to pull you away from KSU, but it's possible you could go there and.
We sure do want to see you succeed.
Yes, that's a possibility that to check into, but.
That's good. I thank you.
Thank you.
Yeah, yeah.
I didn't even know that my cousin goes there, but I didn't even know it's free.
Yeah.
I know my auntie also graduated there, so
Huh?
that's my cousin's mom. So
So we
I
have
think I get a lot
for
of-
everybody, housing and that kind of thing is income dependent. And
They give you work.
everybody works, I think it's at least 30 hours a week, I believe. Campus jobs, so I think you would still be okay, with not having a work visa and that, but it'd be worth checking it out.
Can't hurt to try.
Yeah, particularly before you actually go in the nursing program to see.
I will check it out.
So you've gotten some compliments. Wonderful story of the struggle to get an education. Very proud of you and happy for you. You will make great improvements in healthcare when you go home. I'm so thankful and happy to have heard your story and perspective.
Thank you,
And,
Emily.
yeah, and then Loretta, I appreciate this opportunity and I wish you the best. You will be a great advocate.
Thank you so much, Loretta.
Well, we have actually gone through this hour like that. I mean, this was a great presentation. You did a great job. I love you're so engaged and answered questions so easily. And for those of you online, does anybody have any other questions for our guest? Because we are about at our closing. Thank you for the wonderful presentation.
Thank you.
Okay. Well, thank you so much for
Thank you.
taking the time.
Thank you.
That was really, really engaging, very informative. And I'm just so filled with pride for you. You're working so hard. You're gonna do great things.
Thank you. As they say in my country, Abaraka. That means thank you.
Oh,
Yes.
Your English is very good.
and it is extremely